Welcome to this channel. Myself, Dr. T. N. Devnath, Doctor of Modern Medical Science, motivational speaker and life coach. आज इस वीडियो में हम बात करेंगे अल्कोहल विथड्रॉल के बारे में। अल्कोहल विथड्रॉल के बारे में हम लोग बात करेंगे। पहले थोड़ा सेटअप में ध्यान देंगे। अल्कोहल विथड्रॉल के बारे में हम लोग बात करेंगे। पहले थोड़ा सेटअप में ध्यान देंगे। That is working or not? That is working or not? So yeah. Okay, I need to change the thumbnail. Okay, I need to change the thumbnail. Okay, change the thumbnail. Change the thumbnail. I want to talk about the alcohol withdrawal, क्योंकि alcohol withdrawal symptoms AWS is अगर एडिक्शन में देखा जाए तो वन ऑफ द मोस्ट कॉमन एडिक्शन इज द अल्कोहल एडिक्शन, दैट इज अल्कोहल डिपेंडेंस. नाउ इन अल्कोहल डिपेंडेंस okay, fine. Okay, yes, it's working, so we'll start now. How many of you have joined so far? One or two I can see. Anyway, we'll start. It is a comparison between baclofen. It is a comparison between the baclofen and lorazepam. Okay, now we know alcohol dependence, that is ADS, alcohol dependence syndrome. When we stop taking alcohol after a certain period of time, तो क्या होगा? There will be alcohol withdrawal symptoms. Now in alcohol withdrawal symptoms, if you want to treat alcohol withdrawal symptoms, then the drug of choice, alcohol withdrawal syndrome, the drug of choice is the lorazepam. That is the actually benzodiazepine, BZD, that is the benzodiazepine, and most commonly used is the lorazepam. Why? Because lorazepam is relatively safe even in liver disease. Okay, now in this study we want to see whether we can use baclofen instead of lorazepam. That means what is the efficacy of the baclofen compared to the lorazepam का जैसा है या अलग है, इसके बारे में हम लोग स्टडी एक किया हुआ है, इसमें हम लोग जनरल क्लब में डिस्कस करेंगे. ये स्टडी एक्चुअली किया गया है चंडीगढ़ में, गवर्नमेंट मेडिकल कॉलेज चंडीगढ़, इन द डिपार्टमेंट ऑफ द सेक्रेटरी बाय 3 डॉक्टर्स. ओके, प्रणय गुलाटी, बीर सिंह चौहान एंड अजित सिदाना. Now what they are trying to tell, we'll see in the journal. Okay, now alcohol dependence is one of the major public health problem. Why? If you see 34 to 42% Indian adult will have use of alcohol. If you take a look about the abuser, that is 5 to 7%, and if you notice the number, that is 10 to 20 million person will need treatment for alcohol withdrawal or alcohol dependence. So this is a very huge number, and for that we know that once patient taking alcohol, patient become dependent. Now in dependence condition, if he discontinue, he will develop acute withdrawal symptoms. In acute withdrawal symptoms, now withdrawal symptoms can be mild to moderate. Okay, so how to calculate whether it is a mild, moderate or severe withdrawal? Then we need to know one important scale, that is called CIWA, AR, alcohol revised scale. According to this scale, we can tell whether the withdrawal is mild, moderate or severe. Now, if you look about the mild to moderate symptoms, there will be increased blood pressure, increased pulse rate, tremor, hyperreflexia, irritability, anxiety, and which usually developed within 6 to 24 hours after stopping of alcohol, and it will subside within few days. It gets subside within few days. Okay. However, some of the patient, those are actually the heavy drinkers and will have some other comorbidities. They will go into a more severe condition, what we call it as delirium tremens. Okay. If you look at the delirium tremens, the death rate of this delirium tremens is not very high, but it is not less than also, because if you don't treat in a patient of this delirium, around 5 to 10% patient will die. It's not a very less number. It is definitely a very good number of patients we will lose if we didn't treat this delirium tremens very well. So we have to be very cautious about that. So the drug of choice to treat this condition is called lorazepam. As I already talked about, lorazepam is the drug of choice. That is the one of the important benzodiazepines, is a drug of choice for alcohol withdrawal symptoms. But benzodiazepine, it has some side effect. It has some side effect. We need to know about this side effect, like oversedation. There is oversedation, there is memory issues, as well as there may be respiratory depression. And more so over, these problems are more common if there is any liver compromised. And you know, those are regular user of alcohol, that is alcohol dependence, they will have some liver issues. So benzodiazepines might have some complication if you talk about the treatment of this alcohol withdrawal symptoms in a complicated state, or in a patient having some liver injuries or liver dysfunction. So we need to know some other molecules which can be used in such conditions, so that we should not be dependent on this lorazepam or benzodiazepines, which are sometimes become very risky to use in elderly patient or having the liver problems. Okay. For that, actually we are trying to find out any potential drugs for this treatment of this alcohol withdrawal syndrome rather than this benzodiazepines. And for that, one of the important drug is baclofen, which has emerged as a drug treatment for the alcohol dependence, and it reduces the craving as well as it decreases the alcohol consumption. So that's why we are more in focus of this baclofen. Whether we can compare the baclofen with this the gold standard lorazepam or diazepam, or that means benzodiazepines. So this is all about this study. They have shown that the baclofen is equally good as lorazepam in treatment of mild to moderate condition of alcohol withdrawal symptoms. Remember one thing, we will talk about these details of this study. This is all about what I have talked about. This is all about alcohol withdrawal symptoms, the potential danger of using benzodiazepines on this patient of this liver dysfunction, and is there any alternative. As an alternative, baclofen is one of the important drugs what we see in this article. Okay, the aim is we know the efficacy of baclofen and benzodiazepines. Means baclofen कितना effective है, as it effective as benzodiazepines. This is all about the study. Okay, so study design, it was a randomized study and it was an open label study. Open label study means there is no blinding. Blinding matlab once you have blinding, the word blind. Okay, blind means you don't know actually what you are giving and whom you are giving. The investigator don't know, but here it is, as it is an open label study, so the principal investigator, he knows or she knows which drugs is given to which patient, and the calculation or the evaluation of this patient according to the symptoms might be having some bias, because there is no blinding done. So this is one of the important I want to say aspect of the study, and you can say it is one of the drawback of the study, that it is a open label study. And if you see, this is the study done in the psychiatry department of GMCH Chandigarh, and sample size was taken 66. If you look at the sample size also, sample size is also very less, and it was done for 19 months, and ethical consideration was taken from this concerned ethical committee. Inclusion criteria, we took the age 18 to 65 years because this is the most common age group, and we are taking the males, not the females, because most of the alcohol users are male. It is not like that females are not taking alcohol, they are also taking alcohol, but the trend is going high. Anyway, we leave that topic, and we are included the patient which are diagnostic criteria for alcohol dependence. Now alcohol dependence, if you want to know, there is 6 important criteria for dependence. If you talk about the dependence, there is an ICD criteria and you can see there is C, C, T, H, S, HSW, 6 important symptoms we can see, and we can consider whether patient is alcohol dependent or not. Now CCT is the craving. Okay, craving is the craving, whether patient has craving for taking alcohol or not. This is one of important C. And another is the loss of control. This is loss of control. Okay, T means tolerance. Tolerance means the amount of alcohol earlier used to take to get the addictions or get the benefits of this taking alcohol. Now the same amount of benefits will get after taking very much higher than the previous level of alcohol. Okay, that is called tolerance. Okay, now HSW is the harmful use. He or she knows that this is going to do some harm to the body or social image or anything, but even then they continue the drugs, is called harmful use. Salience means changing of or shifting of the interest to the other subject. Okay, this is one of the important, the main need is having the food and all, but even though they don't have any food or they have money for the food, but they won't spend that money on the food, rather he or she will go to the wine shop and they will drink only. So this is the problem, that the priority gets shifted from one the most priority to the least priority, that is taking alcohol become the major priority or first priority for him. Okay, that is called salience. And lastly, that is withdrawal symptoms, that is we can see the tremor. Okay, withdrawal symptoms like tremors. So this is all about this inclusion criteria. Exclusion criteria, where we try to exclude this patient, those are having any major physical problem, cardiac disease, renal disease, or any other major issues, other psychiatric comorbidities, and other substance abuse. Okay, like opioid use or other substance abuse, we exclude, except nicotine and except caffeine. Right, except nicotine and caffeine. Why? Because these two are very common. We can't exclude this caffeine and nicotine exposure from any of the alcohol users, because these are friendly. No, those who will take alcohol, he or she will take smoking. For smoking, they will go for the nicotine also. So this is a very common practice. So nicotine and caffeine addiction is there. We can't exclude them. Rather, if they have nicotine, we can give them nicotine replacement therapy. Nicotine replacement therapy we can give them. Okay, this was given also, nicotine replacement for them. Anyway, data collection. Now, the alcohol, there is two important topic. One is dependence. Okay, one is dependence, and we need to know how much patient is dependent on alcohol, whether it is mild, moderate or severe. And another is withdrawal symptoms. Now, even in withdrawal symptoms, we need to know whether these withdrawal symptoms are mild symptoms, moderate symptoms or severe symptoms. How we can differentiate this? For this, we have two important scale. That is, for dependence we have SADQ, that is the severity of alcohol dependence questionnaire. Severity of alcohol dependence questionnaire is there, is for the dependence. Remember it for the dependence. And is CIWA. CIWA is a clinical institute withdrawal assessment for alcohol revised, that is done for the alcohol withdrawal. And according to them, we come to know that whether patient is severely addicted, dependence, mild dependence, moderate dependence, and the withdrawal symptoms is mild, moderate or severe. So we used these two important scale. Now, how we this study actually done? Whether the patient coming to the psychiatry department of GMCH, what they did, they select the patient according to the inclusion and exclusion criteria we have already set for them. Okay, once they are selected, they have taken the informed consent, they have admitted the patient, and they try to do the detoxification. Detoxification is the first phase of this alcohol withdrawal treatment. Okay, alcohol withdrawal treatment, there is two important part, because the patient has taken the alcohol and suddenly he has stopped taking alcohol, but within 1 or 2 days, whatever he or she has taken, it will not waste out from this body. Okay, it will take some time to get washed out from the body. That time actually we need some treatment, and that phase is called detoxification. That is called detoxification. Okay, once detoxification is done, then we will go for this de-addiction phase. Okay, de-addiction phase. Actually, the drugs which we are comparing, that is baclofen. Actually, it is given for as an anti-craving. Means the drugs are given usually after the phase of detoxification. And in this study, and they try to provide some information whether that baclofen can be used as detoxification phase also or not. This is the most important point of this study. Okay. Now, patients were assessed for their patterns of alcohol and any major health issues, and any earlier alcohol consumption, and then by the semi-structure questions and examination. Okay, now we have done the socio-demographic. Socio-demographic means where from this patient come, whether they are from the urban, rural or semi-urban. Okay, and we take the education level, we take the income level, and male, female, the different demographic profile we will see in the later phase of this study. Okay, then we have done the routine investigation, that is baseline investigation for all the patient admitted for this study. Okay, and severity we have done by the set scale of the dependence, and withdrawal severity is done by the CIW scale. And then we have taken actually 66 patient. We all know sample size, that is called sample size is 66. In out of the 66, we have divided into two groups. One is baclofen group, one is lorazepam group. Okay, baclofen group is called, we are doing the experiment with this group, so we call it experimental group, that is EG is the experimental group. Lorazepam is the control group. Okay, lorazepam is the control group. Now, how much dose they have given? Okay, for baclofen they have given 10 milligram, 10 milligram and 10 milligram, that is total 30 milligram of the dose they have given for the baclofen. And for lorazepam, what they have done, they don't give any exact dose, rather they have given a flexible dose, that is 8 to 12 milligram per day. 8 to 12 milligram per day. Now if you see one ampoule of benzodiazepine means lorazepam, if you see there is 4 milligram if you buy from the outside, but if you take from the government hospital it will contains 2 milligram and it will be 1 ml of ampoule. And if you see the ampule, that is 1 ampule is equal to 2 ml and which contains total 4 milligram of this lorazepam. Now we can use up to 3 dose. 12 milligram means we can give 3 injection per day, means TDS, 3 injection per day. 3 injection TDS we can give for lorazepam, and TDS we have given baclofen, but baclofen is given in a fixed dose, okay, but lorazepam is given in a flexible dose. This is also one of the drawback of the study, okay. And then we know the alcohol patients, we need some vitamins, that is vitamin B1, thiamine, that we have given 100 milligram per day IM injection for 5 days for all the patient, okay, for all the patient. Then now once the patient of this alcohol de-addictions or alcohol addictions, we need to motivate them, okay, we need to motivate them. Once they become little stable, we need to motivate them. For giving motivation we can give, there is motivation enhancement therapy, MAT therapy, and these are actually given in the study by a clinical psychologist, that is by the clinical psychologist, okay, qualified clinical psychologist. Now remember, lorazepam has very good sedative property, okay, but if you look at the baclofen does not have that much of sedative property, or patient might have some sedative issues. So they have given in the baclofen group, they have given one tablet which actually acts as a very good onset for the any problem in the onset of the sleep. If you take the tablet, it will take care of that, and that is called zolpidem. And zolpidem they have given 10 milligram per day for this patient, but some of the patient has used, some of the patient did not used, okay, but how many days or how much they have used, it was not given in the study. That is also one of the drawback of this study. Then we have gone for the statistical analysis. We will see the result and observation. Now data analysis, chi-square test, chi-square test is given for this. Actually the nominal data like blood group, okay, blood group is a nominal data, it is a qualitative data, and it is done by the chi-square test. For the ordinal data, if you talk about the ordinal data, they have given ANOVA test is done if there is more than 2 groups, okay, and data analysis we have done on the SPSS, and we have taken the percentage mean and standard deviation, and we have kept the value of p value, that is significant p value is 0.05. Now result, if you see the baseline of this both the groups, group of the baclofen, group of the lorazepam, okay, baclofen and lorazepam, if you see the hemoglobin level, it's almost same, and if you see the p value, what we have said, p value, if p value is less than 0.05, we call it significant, but if it is more than that, it is not significant. That means the groups of both the drugs are equally effective in this case, okay. Now if you see p value of any of this data, चाहे वो platelet हो, चाहे वो total bilirubin हो, SGT SGPT हो, any of the data is not less than 0.05, that means the data is not that significant. That means the significant is that both the group will have the similar outcome or the similar presentation, okay, and it is the same of the socio-demographic data. If you take about the education, we have talked about this education, no, in socio-demographic data we see occupation, we see family type. We see your income, we see whether you are married or not, and which region you are from, and you are from the urban, rural or semi-urban. These are the few important points in socio-demographic profile we used to check. Now this is one of the important slide, or I can say one of the important slide of this seminar. And now here what we have seen, here we have seen this one, and this side, this is the total score. This score is actually CIWS score. That means we are talking about the withdrawal symptom score. We are talking about the withdrawal symptom score. Now withdrawal symptom score, we know if it is 15 is the baseline, 15 if it is less than 15, if it is more than 15. More than 15 is the severe. If it is between the 15, then we call it as moderate, and if it is less than 8 or 9, then we call it as a mild. Or okay, so if you look at this, is around 15, that means we are talking about the moderate amount of alcohol withdrawal symptoms, AWS, moderate. Now this study, they have already mentioned that they have taken the cases for this moderate, mild to moderate withdrawal symptoms. They have not taken the severe withdrawal symptoms, they have not taken the delirium tremens, they have not taken the complicated withdrawal symptoms. Why? Because in complicated withdrawal symptoms, management is little different and it takes time, and it's also if you use only baclofen in this patient, and we don't know the efficacy of the baclofen till whether it is very good, very effective or not. And if we give only baclofen for this patient, those are very severely in withdrawal symptoms, we can lose the patient. And in any of the study, no one will try to lose any patient, and it will be a very big ethical consideration. Okay, so that's why they have not taken the severe cases, they have taken the mild to moderate cases. Okay, and even we are seeing that the cases, the alcohol withdrawal symptoms, if you take the score, and we can see we are dealing with the moderate alcohol withdrawal symptoms. In the moderate alcohol withdrawal symptoms, the blue one is actually baclofen, red one is the lorazepam. Now how much they both the drugs are able to control the withdrawal symptoms. Now if you look at this, if you look at this, both the drugs are able to minimize or manage the withdrawal symptoms very well. It is on day 1. Now in the day 2, you see the response is almost similar. Okay, baclofen is little actually not that good compared to the lorazepam, because lorazepam has reduced the symptoms more than the baclofen, but it is not statistically very significant. The difference is not very significant. And in day 3, we can see the gradually on the day 8, the detoxification has completed on both the cases. That means both are equally effective for the management of these alcohol withdrawal symptoms. Even if you take the average amount of alcohol in the gram per day have taken, and both the group will have almost similar. And if you see the p value, we know the significant p value is less than 0.05, less than 0.05. okay, less than 0.05, but here value is more than that, so it is not that significant. Not that significant according to the age also, and not as significant in the moderate amount of alcohol withdrawal symptoms also, or dependence also. Okay, so we can say that both the drugs are useful because both the drugs are done very well job in managing this alcohol withdrawal symptom. On the day up to the day 8 of detoxification, they have completed the procedure, they have completed the treatment. Both the drugs are well tolerated for both the cases. Okay, so according to this, the baclofen is equally effective as lorazepam in managing withdrawal symptoms. Remember that withdrawal symptoms is mild to moderate, not the severe one. And if you look at this discussion and all, and it is clearly they are trying to say that lorazepam has certain amount of side effects and certain amount of limitation, because in liver diseases we need to reduce the dose of the lorazepam or we need to change the drug. Okay, but if you use baclofen, we need no need to change the dose of the baclofen in liver disease. And so they are trying to say that in cases lorazepam are contraindicated or not, that means having some side effects, in that case baclofen can be used as treatment for the alcohol withdrawal. But remember, again the study is sample is very less, and there is no so much of study on that the baclofen is superior. Rather, the modern studies or recent studies, if you see, we can mention some studies which is done on 2018 and all. They said that even there may be some supremacy, but if you increase the dose of the baclofen, there will be some problem in the tolerance of this baclofen because of this side effect. And another, they mentioned very well that lorazepam has the side effect of the liver and we need to change the dose or reduce the dose, but they have not talked about the baclofen, that in case of chronic renal disease we need to change the dose of the baclofen also, because baclofen is also not very safe in renal disease because it is passed through the renal or kidney. Okay, so they have not taken the negative aspect of the baclofen, they have talked about the positive aspect of the baclofen only. So if you look at the study at a glance, you can see that is baclofen is equally effective as lorazepam. But if you see all the studies, and they will you will find that there is some discrepancies, and data is not very clear, and data amount of data or the study is also very less. So definitely very less. So definitely we cannot rely on the baclofen at this moment to treat the alcohol withdrawal symptoms, especially in case of severe withdrawal symptoms, and we need much more studies to comment on this. And if you talk about the limitation, already I have talked about this all this point. Okay, and conclusion, they are trying to say that it is equally effective, but definitely the newer studies, they are showing that though it shows some effect, but promising results are missing, and there is some data are not that good and not that level. So definitely we need to wait few times more to have much more trial on this baclofen as a not only as an anti-craving drug, rather it can be used as detoxification phase. So we need to wait, we need to see, and there are lots of studies going on baclofen, because it is one of the promising drug which can be or might be it can be used as alcohol detoxification as well as alcohol de-addiction, where it will reduce the craving and alcohol consumption. Thank you so much.